Hi, it's RTV Avenue, and today we're going to talk about cath care. We're going to talk about the male catheterization. I went ahead and checked up my physician's orders, and he has ordered a male catheterization. Before going into the room, you need to gather all your supplies that you're going to need to complete the task. So as I'm walking into the room, I wash my hands, don clean gloves because this is a sterile technique. However, before you touch the patient, you need to have gloves. So you need to check your patient's armbands, get them to state their first and last names and your date of birth, and compare it to the wristband for a safety check. So for the male, we're going to ask him to have him on his back with his thighs together and slightly apart. We're going to drape. We're going to drape over this area here to keep him somewhat just a little dignity, so he's not so exposed to everyone. Make sure the door is closed. The next thing is immediately we have a prepared Foley catheterization kit. It is a sterile technique, so when you open it up, make sure you touch the outside edges of it, which is contaminated. So, and also open it away from you, and you never want to cross your sterile field. So let's begin with opening the sterile tray. We're going to open it across from me, here, here. Just kind of spin it. And now I'm going to just take these guys out. This is the drape we were previously talking about. You want to make sure that you have the shiny side down. Okay. This acts as, this extends our sterile field. We are going to drop it on top and close. Okay, touching the outside edges of the sterile field. Now, we will now, let's see. We are going to get sterile gloves. Bear with me. All right, for the video purposes, obviously you want to keep the inside. You don't want to touch the outside, but to speed up the process, I am going to touch the outside just to get the gloves on faster. But this is a sterile procedure again, so you don't want to touch the gloves. All right. These next steps, you want to make sure that you're testing the balloon of the catheter to make sure that it blows up properly before you go through all these steps, and it doesn't work. So, all right. So I'm gonna go ahead and open everything up. I'll move this here, here. You can drape this over the patient just for an extra extent of the field. Let's see. You have your catheter. You have the petroleum jelly. You have the saline to make sure your balloon is properly working. So let's go ahead and test that now. This is a sterile technique at this point. Nothing has been exposed. I don't know if you can see in the video, the balloon blowing up. Come back off of it. Okay, perfect. So the catheter is working at this point. At this point, this is trash. You can kind of just toss it out of your sterile zone. Just make sure this is all rolled up. And just kind of keep it contained. Also, I'm not going to make a mess, but you do take the petroleum jelly, put it inside of the tray here that comes with the kit. keep it there and then keep it there for the next step. So you put the petroleum jelly, take it into your catheter, and gently roll the catheter head inside of there. You can lubricate roughly, I'd say, 1 to 2 inches of the tip of the catheter. But this next step, so you have everything prepared. You have the catheter has petroleum jelly on it. The balloon is working. The next step is we're going to have to clean the male penis. We're going to clean starting with the head. And I'll open this up here so you can see. He's here. You can start in rotations, swipe, and then gradually work your way out. So it's clean. The petroleum jelly has been on the front of the catheter. Everything should be fine. Also, one other step: if the patient isn't circumcised, you need to pull back the foreskin and clean as well around that. So we don't have that situation here. He's circumcised. So now we are going to insert the catheter. After all the checks have been completed, it's now forward. So you want to take, let's see, my left hand and roll it up. Okay. Actually, I'm going to take my right hand. Now, one hand, you're going to have to decide which one isn't going to be sterile. I'm going to take my right hand, and after everything's clean, everything's still sterile, this hand's going to become dirty or not sterile anymore. It's going to become clean. So we're going to instruct the patient what's going on and tell them that it's going to be a little pain or discomfort. So you just gradually press it in. Should get a little flashback and just keep going a little further. Okay. Once it's in all the way, you want to take this hand, keeping this hand here and just holding it. This hand's going to be clean. This is sterile, so you just gradually want to force it in, not touching this here on the catheter because you're going to feed it in and you don't want to cause UTIs. That's one of the main hospital-acquired infections, this stuff right here. Okay, once it's in there, I'm going to take the balloon and we're going to blow it up. Okay, once it's in there, and push the whole deal in. Okay, now take that out, and you should be able to. It should be locked in there pretty good now. Okay, next step is really important. You want to make sure in the kit we have, they don't come in the kits we have, but in the hospital setting or the clinical setting, there's a kind of like an adhesive bandage, but it has 2 straps on it. You want to allow, so say you want to put it here, right on the upper thigh. You want to allow a little room so the patient is able to move without yanking the catheter completely out. So you put the bandage here, it has 2 straps, and you fasten it down. That actual steps of the catheter, that's the bulk. That's pretty much everything with the catheter. So again, you just want to, in your documentations, you want to make sure and record the time of the catheterization. You want to just record the size of the catheter. I believe this is a 14. You want the amount of urine removed. So say the patient was describing not being able to urinate. Odds are this patient probably has 300 to 400 milliliters of urine in there. So you're definitely going to get relief after this. But make sure that you document all of your any redness or swelling, tenderness on the area throughout the process. But that is the male catheterization. Thanks so much.